All yours.
Sorry, I'm under a clock here. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, GL Chapter 30A, paragraph 20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Harwich Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in order. The first agenda item was reorganization of the board. Matt, due to a glitch, has not been approved. He will be reappointed, but the selectmen did not have a chance to get to that last night, so they will do that next week. So he's here, but he cannot participate in a vote. So I'd like a motion to postpone the reorganization until next month when we have a full membership attending.
Make a motion that we postpone the reorganization till next meeting.
I seconded.
Okay, and I agree. So all in favor?
Aye.
Sharon?
Sharon, aye.
Myself. Okay, so
Aye.
we'll do that next month. Okay, I call the meeting to order now. Okay.
Just do your roll call vote because it's a remote meeting.
Oh, I'm sorry. Matt, are you present?
Yep.
Sharon, are you present?
Yes.
And Ron, are you present?
Yes. Yes.
Okay, all accounted for. Thank you. We're going to vote to approve the minutes from the previous meeting on June 16th. Everybody have a chance to look that over? Any questions or changes?
Nope.
Okay, do I hear a, excuse me, to accept the minutes from June 16th? Just
I'll
a
propose
minute.
that one together.
Okay. And Sharon, you second?
Yes.
Okay. And I'm in agreement. And everyone is accepting the meeting minutes from June 16th. Okay, Megan.
Okay, so moving on to the Board of Health work session. Item A is a COVID-19 update. We did meet last week, so we don't have too many new updates since then. We did have 5 new cases over the last 4 days. So our cases are up to 136 in Harwich and 7 active cases right now. Quite a few of those active cases are related to younger hospitality workers, and we have gotten the VNA involved to do greater contact tracing of those individuals to ensure that restaurants and motels and other hospitality businesses, that those owners are aware that some of their employees may have been exposed at a private party that happened a couple of weeks ago. So we're seeing quite a few increases now due to the 4th of July weekend and just some gatherings that we have been made aware of. So we've also made the restaurant owners aware to just keep a closer eye on their employees while they're working to make sure that they don't appear to be sick, and interview them to find out if they have been at any large gatherings, and then encourage testing if the answer is yes on those. Other things for Board of Health, we've had really great success with our COVID enforcement agent with the county, the COVID compliance inspector. He's very reactive and will go and check things out just by an email or a text, and he is doing really well. And I think that businesses are being able to talk to him and get some questions answered, and hopefully we'll see better compliance the more he is visible in the community.
Megan, whatever happened about the port? Did that straighten itself out?
Yes, they did everything they should do. They closed immediately when they found out that they had a restaurant worker that was positive there. And had it professionally cleaned. They notified any other coworkers that worked with the person who was positive, and they notified any reservations that had been made for that person's shift during her infectious period. So they did everything properly, and we've had additional restaurants and businesses that are undergoing the same situation. And I think it's important to know that when something happens, they do contact the health department. So we're involved, just like a foodborne illness, would be involved with this. So yeah, they did well. They closed, and we haven't had any further issues.
Very good. Okay. So that, because it was in the paper too, you know.
I know. Yeah. Yes. And over the next week or so, I'm sure we'll see more establishments in our surrounding towns that had gone through the same thing. It's going to be, unfortunately. We've had requests to know exactly what shifts and what establishments have been affected by COVID, and unless I'm directed otherwise by you all, I'm not going to make a public announcement about every establishment that has a positive case in surrounding it, because they're usually taken care of and handled, and alerting the public doesn't really change the outcome, unless it's, of course, a personal service or something like that, where the worker was working individually with a person. But if it's a restaurant, as long as everyone's paying attention to the rules of social distancing and hand washing and wearing their masks, restaurant workers should not have any close contacts with their patrons. Any COVID questions or comments?
No, I'm all set. Anybody else?
Did that, we voted on something the 15th. Is that on our review now to vote on that, or how's that working?
Yep, it's on your agenda.
Okay, just want to make sure.
In the packet. Yep, that's after all of our old business.
And I want to thank Jennifer for doing that under the crunch. Appreciate it.
Indispensable assistant. Okay, so moving on to the next item on your work session agenda is a discussion on public and semi-public beaches. We had a meeting last month where there were some questions that came up on public and semi-public beaches and what the regulations were and what the past results looked like. So what we did was take our bathing beach report that was written mostly by Katie, my senior inspector, and she writes that for the town report, annual town report. So we took parts of that to explain what indicator organisms are. So we test freshwater swimming areas for a bacteria that's different from what we do for marine bodies of water. And like the name implies, it's an indicator organism. It means that other viruses or pathogens might be present, and it requires further testing. So things like stormwater runoff, high bather loads, or animals in the area like pets or wild birds or seals, those common wastes can influence the test results. So the bathing beach regulations require weekly testing of all public and semi-public beaches. And a semi-public beach is a beach that is owned and operated by a private entity, but open to not just the homeowner. So like a motel beach or a condominium beach is a semi-public beach, and they also have to adhere to these rules. And every beach needs to be tested prior to the bathing season, which is just around Memorial Day. And then weekly thereafter, unless there is a variance. And we do have 7 beaches out of our 26 public beaches and 14 semi-public beaches. We do have 7 that have a variance that allow monthly testing instead of weekly. And a variance, so variances are allowed by the Commonwealth if we do a sanitary survey. And the survey includes things like sources of contamination, outfall pipes, which we don't have any outfall pipes, but we do have some stormwater discharge pipes. They look for bird populations or agricultural drainage. And we take all of that information and put it into a document that's reviewed by the state. And if they don't see any reason why our beach would be impacted by one of these indicators, then they look at the last 4 years of testing data. And if a beach has not failed in the last 4 years of their weekly testing, so 4 years worth of weekly testing, then they allow to vary the weekly testing and to do monthly testing.
What beach would that be example of?
Right now, Brooks Road Beach, Earl Road, Neal Road, Pleasant Bay Road, Wawatasi.
Pleasant Street?
No.
Pleasant Street Road?
No, we have 2 Pleasant beaches. One is Pleasant Road Beach, which is on the south side off of Lower County Road. And then we have Pleasant Bay Beach, which is also called Jack
that's Route 28, right?
Yes.
Okay.
Yeah. So that's
so those
essentially
Pleasant Street or Pleasant Road, which one is the one that's variable?
Pleasant Bay, Round Cove is the one that does monthly. Yeah.
Okay, those are monthly. Okay.
Yeah.
Okay, so Earl Road, Brooks Road.
Earl Road, Brooks Road, Neal Road.
Neal Road.
Zilpha and Wawatasi. Zilpha.
Okay. Oh, okay. Well, I live down from Wawatasi, so that's good.
Mm-hmm. Yep, the water quality is very good down there.
Very good.
And we put in your packet the last couple of years worth of test results for these varianced beaches. And every month they come up with results that are less than 2 or 4 CFUs, which is a contamination level. It's a colony forming unit. So the maximum contamination level for marine water is 104 CFUs per 100 milliliters. And these beaches never exceed 4 over the last 2 testing seasons. And we could have gone back farther, but just for the last 2 years, they have been less than 4 for these beaches. So that's the bathing beach program. The county right now comes out on Thursdays to test all of our beaches. They sample the waters in the morning and then bring the bottles to the lab in Barnstable County. It's a program that's sponsored by Barnstable County, so it's paid for through the county. They pay for the staff and the laboratory time and expenses to do this. So that is another reason why variances are beneficial. If our water is clean every week, week after week, and we can reduce the expense associated with testing it, it's beneficial to us in the county and the taxpayers. And then we get the results 24 hours later. Everything has to get put in the incubator, and it takes 24 hours to get results. And if something should be positive or exceed that 104 CFUs, then we get a call from the county lab, and we have to resample that beach, and they usually take care of that for us. They send out their sampler immediately and collect another sample. And if the second sample fails, then we have to close the beach. One single exceedance does not mean we have to close the beach. So it's only when it fails two days in a row that we have to close it to swimming. So this report is something that goes in your packet every January, and it also, parts of it go into the annual report that is part of the town reports. So if you have more questions, you can look through that, and people can, you guys as well as anyone, can go onto Barnstable County Health and Environment's website, and they have all the beaches that they test throughout the entire Cape, and the test results available online. And they do it pretty quickly. So if they test this week, the results will be available for viewing on their website next week. And they do the same thing. You can go back years to look at test results.
Wait, can I make an observation?
Sure.
You can shoot me if you want. All right, looking at the page that on the bathing beaches. In that first paragraph, they talk about the enterococci as the indicator for marine water and E. coli for fresh.
Mm-hmm.
If you go down to paragraph 3, in the middle, it says the maximum allowable number of enterococci are 104 CFUs per 100 ml of marine water, or 235 colony forming units per ml of fresh water. Should E. coli be inserted in there? The 235 yes. Should be for E. coli.
Yeah,
okay.
You are correct. Yeah. And if a variance beach does fail even one time of those monthly tests, then the variance is null and void. So if a beach that has a monthly testing schedule is tested and fails their first and passes their second, they still lose their variance, and they have to go through another 4 years of clean water testing.
Okay.
Might make another observation.
Sure.
Looking at that little chart, it talks about the beaches, with the variances, and it looks like all of them, like in 2018 and June of 2019, it's all either 2 or less than 2. And then in July of 2019 and August, I see some that are at 4. The fact that if you're starting to see in that area, and I could be misreading this, looking like it's moving up in those, I'm going to say 4. places. Is that something that you start to be concerned about when you start to see that?
Yes, if they were greater than 4. I mean, 4 is such a low level. Yeah. I mean, if we had started to see them in the 20s or 30s and then continuing month after month getting worse, we would look at changing the variance criteria. All the variance beaches, all the data is looked at by the state every year. So they are the ones that approve the variance, not just the local Board of Health, but it also has to go to the state to have the variance approved. So they also look at all of the data.
Okay.
We offered some COVID beach signs to some semi-public beaches that we had left over. We had 3 or 4 that, actually more than that, I think we had 5 that we didn't need for our own beaches. Barnstable County Reopening Task Force had some very nice signs made for beaches that have beach rules on them, reminding people to social distance as well as wear their masks and 1 person at a time in the bathroom, that sort of thing. So they're big. They're 24 by 36, I think. So then they're nice metal aluminum signs, brightly colored. So we ended up giving some to the semi-public beaches. We have like 7 or 8 minutes before the next part of the agenda. I can go through a little bit of my monthly report if you want.
That'd be great. Yes.
Yeah.
Okay.
Right.
So I wrote this on the 16th, which was last Thursday, I think. And since then, we've had 5 additional cases. So we had 131 when I wrote it, and now we have 136. And instead of just 3 active cases, we now have 7. So some are travel related, some are relatives of people who had come up to visit either from out in California or down in one of the southern states. The weekly Department of Public Health data shows the number of tests that are conducted for Harwich, for all residents in each town, but it does break it down to the town level. So every Wednesday after 4 p.m., you're able to go on to their website and look at how many residents in Harwich have been tested. And as of last week, 2,117 people in Harwich have been tested for COVID-19. So that's good information, and it kind of shows you what percentage of the population is positive. So
negative, you mean? Negative.
Positive and negative, yes, my percent of the population, both ways, yes.
Yeah.
Also in my weekly or in my monthly report, we had some other things that we've kind of already discussed, but the COVID enforcer person is doing really well. Let me get to the rest of my report. Scrolling. This is a long one. The vacant health inspector job. So I think I let you know that Mark, our part-time inspector, has left, and we have a current vacancy in the department for the part-time inspector. That job posting has been up internally as required, and as of tomorrow, it can be posted outside of the internal union. So we have it on the next week's Chronicle paper. So it won't be in this week. It will be in next week for that position. Other things. For our June report, we've already talked about. And just my wonderful staff that I want to thank publicly. Jen and Katie have been doing amazing work. They are always there when I need them and able to get many, many questions answered from the phone and the emails every day. I know they start before we even get there. There's always a ton of voicemails and emails that need to be answered. So just thank you to Jen and thank you to Katie.
Yeah, thank you. Have the number of calls and emails decreased at all in the last maybe 2 weeks? No. No, shaking your head, Jen. Okay, just curious.
No, most of the calls are mask calls, I would say. People upset about not wearing masks or food establishments that have problems that we have to go and check out. And that's thankfully what our inspector does now, the one from the county. But even just regular health department business, I feel, is just as busy as it used to be. People wanting as-built and submitting plans. The test hole schedule is full every week. Building permit turnarounds are, we're doing pretty well with that, but they just keep coming. So we have lots and lots of questions for that. And now with a lot of different places having positives, we're fielding a lot of the calls that are questions on how do I isolate and how do I quarantine and who does what and can I stay in the same house as someone who's positive? Like we're spending a lot of time doing that sort of thing.
Yeah, it's not a simple answer. You have to explain a lot of stuff.
Yeah. All right. Well, we've got 3 more minutes, so permits, we can go through permits. Find the permit list. On the permits, we have, where's the permit list?
It's on the agenda,
Oh,
Megan.
Okay, thank you. I'm trying to find it at the bottom. There it is. Okay, so on the permit list, we have a couple of new food establishments. Pizza Shark is a new establishment that has gone into the old Local Flavor building, the old Pleasant Lake General Store. They are proposing.
Okay.
Yeah, that right now they're focusing on ice cream through the takeout window while they do some renovations to their kitchen. But they are going to be called Pizza Shark, and they want to do pizza and also remain as kind of a general store as well. They've requested a beer and wine license to sell to be a package store as well for beer and wine. And they are proposing to have some deli kind of sandwich things as well. So we have done our inspection there. We don't have any objections to approving that. The second new one is the Shaw's on Siston Road now has a Starbucks in it. Very similar to all of the Starbucks. So we've inspected them and also don't have any issues with their permit or application. And Sweet Izzy is a brand new establishment that is behind the trampolines. It's a new building. They are.
When is that going to open up? When is that going to open?
As soon as they get their occupancy permit from the building commissioner, which may actually have already been issued, they may be operating as soon as this weekend.
Okay.
So those 3 establishments are new, and the rest are renewals. So I just need you to vote on the permits.
Okay, do I hear a motion to accept?
One other question before that is that when is that pizza shop going to, is it open right now?
Right now, they're just offering ice cream because they haven't gotten their pizza ovens in yet.
Okay.
But I'm hoping they'll be ready soon.
So we can, is that just a permit for ice cream right now, or what happens when they get their pizza oven in?
We'll just re-inspect it and make sure it's all set. Yeah,
Sure.
You don't need to continue a license unless you'd like to.
Sure, no problem.
Okay, do I hear a motion to accept the permits for the month?
I'll make a motion to accept the permits.
Sharon, can you second it?
I did. I did. I just wasn't
you
turned off.
Oh, okay, sorry, okay. So
Okay.
all in agreement to accept the permits?
Sharon, yes.
And Ron, yes, and myself,
Yes.
yes. Permits have been passed.
Okay.
I have one other question. What's a monoparty?
It's they sell bottled olive oil, so it's bottled.
Oh, okay, all right, okay.
It's just an event
Where are they
permit.
located?
They're selling it at the farmer's market.
As part of the Star Market?
Nope, it's a standalone event permit, so they're their own business. They go to events and fairs and festivals and.
Oh, they're like they're like a laundry unit, something like that? Like,
Yeah,
do they have,
yeah.
what do they have, like a truck or something like that?
Nope, they have a tent, like you'd see them at a craft fair or something like that, and they sell their
All right, I see.
bottled olive oil.
Okay. Now, I didn't know that Dr. Cavity has candy, right? Is that the idea?
Yes, so Dr. Gravity's is the kite shop and Dr. Cavity's is next door.
Right, same thing.
Candy
Same
shop.
thing. Yeah. Okay, all right.
Same owner.
Yeah.
Same thing. He helps out.
Yeah, he does help the dentist industry out, you're right. Okay, old unfinished business. Item A, a hearing for Delroy Murnane at 113 Brooks Road to consider a variance request made to upgrade a Title V septic system prepared by Moran Engineering Associates LLC, continued from May 19th, 2020, Board of Health meeting. Hey, Dan.
Open the meeting.
Hello, everybody. We made a decision to change the location of the leaching area, which is further away from the wetland. So the original plan that went before you in May, we would like to rescind that. And then I think the next thing on the agenda would be the new plan, which environmentally would be an improvement, and that it's further away from the wetland out in front of the house. So we just want to, I guess, rescind that application. Correct, Megan?
You just want them to vote to, you want to withdraw it without prejudice.
We'd like to withdraw the original application, and then we'll propose the new proposal. Will be the next hearing, I believe.
Okay. Do I hear a motion to withdraw this application without prejudice?
Make a motion, we withdraw the application.
Second.
Okay, so Sharon is a yes, and Ron is a yes, and I agree. So that part's done, and now we're going to open, have a hearing. How should I word that, Megan?
Yeah. So new business, we have a hearing for Delory at 113 Brooks Road to consider variance request to upgrade a Title V septic system prepared by Moran Engineering. So now you can start fresh.
Okay, open the hearing. Okay.
All right, Dan Croto from Moran Engineering. I'm here and I see that Joseph Delory, the owner, is also on the go-to meeting. So this proposal, the current building is just served by cesspools. Joe's family is keeping the house. It's just time to, it's past time to upgrade to a legitimate septic system. So it's going, the cesspools would be filled in, and then we would pipe to a new septic tank, pump chamber, and then to the front of the building on Brooks Road side, where we'd have to create a cement wall because of the setbacks and to get the 5 feet above groundwater. And pump it up into that wall. Multiple advantages, environmental as well for the owner, for having a new septic. But we're getting much further away from the wetland, the legitimate wetland. The whole area, I should point out, is in the floodplain, but we're away from the actual the vegetated wetland. So, which the cesspools are now within that 100 feet. It's a very old building, very old septic. So we're just getting as close as we can to bring it up to current Title V and environmental regs. And I think we can get pretty close. So as we go out front, we still don't have the room to meet all regulations. So we're asking in the first variance you're supposed to ask for through Title V is the setback to the lot line. So we're asking for the setback to the lot line to the north, which is in the Hoyden Street layout line. So we're asking to be 5 feet from that. And then also reductions to the building's crawl space down to 16 feet, 18.5 feet. We're asking for it to be a 1.5 variance and a 4-foot variance. And I think it's a huge improvement over what's existing there for treatment and distance to the wetland. And I think the owners will be very happy to be able to use. I watch every gallon of water they use. So with that, I will leave it for questions from myself and the owner, Mr. Delory.
Okay. I'll close the hearing. Any comments from the board? Questions?
What does Megan think about it?
That's right, Megan. I'm sorry.
Okay. You guys discuss and then you can ask me my opinion. This is a great improvement over the previous plan. The previous plan had the SAS in the backyard and required a variance to the wetland. So it's been revised, and I recommend approval of the variances with the condition that no increase in bedrooms, habitable space, or square footage without further review by the Board of Health, and that the dwelling shall be restricted to a maximum of 4 bedrooms, as well as recording the variances and conditions at the Barnstable County Registry of Deeds.
Okay. Any other questions? Okay, do I hear a motion to accept Megan's?
I make a motion that we accept the home variances. Is that what I would?
Seconded.
Okay.
Okay. All in favor?
Aye.
Aye.
Okay, Sharon and Ron say aye, and myself says aye. The motion has passed. Thank you.
Great, thank you.
Dan, you
Thank
can
you,
bring
everybody.
the green cards in or mail them to us or drop them off at some point.
Okay, sounds good. Thanks.
Thank you.
Thank you. Have a good night.
All right, so the next hearing you have on your agenda is for Lawrence at 24 Central Avenue. It is to reconsider an order of conditions granted on May 1st, 2012, which stated no increase in square footage, the number of bedrooms beyond those shown on said plan by Moran Engineering dated January 18th, 2011, which was further revised on March 27th, 2012. This project consists of adding approximately 50 square feet on the first floor and expanding the second floor by approximately 200 square feet to become a full second story.
Good afternoon. For the record, Thad Eldridge, East Southeast, can you hear me?
Yes.
Yes.
Very good.
Go ahead.
As Megan stated, we're here with 24 Central Avenue. The septic system is in, the variants have already been granted, and we're looking to request for the Board of Health to modify the restriction on square footage and allow for about 300 square feet of addition. That'll bring the living space from about 1120 to 1420. The next step, if you do approve this, would be zoning Board of Appeals. If there are any questions, I'd be happy to answer them.
Okay. I'll close the hearing. Any questions from the board?
I actually have a question for Megan, and this is just for clarification for my purposes. When somebody has something that has gone through that was approved, which was the other variances or 2012, and it was stipulated that no further square footage be allowed. When this comes back before the board, then I guess I don't understand if you've already said no new variance, or are we just saying no new variances without coming to the board?
Well, no new expansion without going to the board.
Expansion, yeah, correct,
Right.
yeah.
So they're not asking to make the variances that are already there any worse. They aren't impacting the septic system at all, but because so anytime you do a variance, you usually restrict it because it didn't meet the full code. And so just like the one we just did with Brooks Road, that variance is approved pending those conditions that they don't expand their house because the septic system couldn't fit 100% compliantly with what was there to begin with. So this situation with 24 Central, the septic system couldn't fit with the footprint of that house. The footprint of the house isn't changing with this proposal, so they're not making their variances any worse. The reason why we put that stipulation on as a condition is so that you have the opportunity to review it again and to ensure that the livability or the living space of the house isn't expanding beyond the capacity of the septic system. And in this case, the number of bedrooms is staying the same. They're actually reducing the number of rooms in the house. So with that, you would be able to consider whether or not it's impacting the septic system further and whether or not you agree to allow it to happen.
All right, that answered my question.
Okay. We did have a discussion, I believe, back in the fall about expansions that have environmental variances. So one that may have had a a variance to allow the leaching to be closer to the wetland. This is not that case, but just to keep in mind what decisions have been made in the past. Decisions to allow expansions on homes that have environmental variances to wetlands, the Board of Health has approved those with the condition that alternative technology to be included in the septic system. This particular lot is not near a wetland, so okay. I wouldn't recommend you require it.
Okay. Any other questions? Do I hear a motion to accept?
I'll make a motion to accept.
I second.
Okay, all in favor?
Aye.
Aye.
Sharon and Ron agree, and I agree, so motion's passed.
Thank you much. Have a good evening.
Thank you. You too.
All right, so the next item on your agenda is a hearing for Wakeby Development Corporation at 42 Marlin Road to consider a variance request to upgrade a Title V system prepared by Engineering Works Incorporated. And I believe Pete McEntee.
Where's Marlin Road? Where's Marlin Road, Megan?
It is Marlin Road. I'm looking at it. So every plan that comes before you will have a locus map on it. Mm-hmm. And this plan, so Marlin Road is near Seahorse and Periwinkle. It's out in the South Harwich area, and you're off of the north side of Depot.
Okay, all right.
And Pete McEntee was here, and now I don't see him. So if you want to wait on this one and do the last couple and see if he comes back.
Sure, okay. Let's do that.
All right. So then we can move on to item D, which is a show cause hearing for Borthwick at 7 Phillip Court. Failure to comply with Health Department order to upgrade a failed septic system. Oh, Pete just came back, but we'll continue on with 7 Phillip Court. I know the owner, Robert Borthwick, is on the line as well. So background on this one, we received a complaint about an overflowing cesspool there at this address back on May 28th, and it was verified by our inspector, Mark Pacelli. We sent a notice of violation that same day, which notified the owner of the complaint, and that order letter gave 45 days to upgrade the septic system. That order was received on May 30th. On June 15th, we received a second complaint, and that one as well was verified by our inspector that the system was still overflowing. And so on June 22nd, we sent another order to abate a nuisance and notice to appear before you, the Board of Health, today. Since that time, on the 26th of June, Bass River Engineering scheduled soil tests for the property, which were conducted on July 7th. As of today, we have not received any application to upgrade the septic system.
Is it still leaking?
I don't know as of today, but I know Mr. Borthwick, the owner, is on the phone, is on the line, and we can ask him some questions about when it was pumped.
Sure.
Robert Borthwick, that's my father. My name is Pam Ross. He's really sick. He was just home from the hospital. He was in ICU and on life support for a while. So I'm new at this. I have no idea. So I'm hoping you guys will guide me. I have the plan in front of me from the engineers. The septic has been pumped twice, and they've done holes, I guess, I'm trying to think. Test holes are been dug. They've got, I guess they've started it. I mean, I've paid half to Robert Hour already for it. I'm just not sure what I have to do now. Did you hear me? Okay.
Yeah.
Okay.
We did hear you. So you
Okay.
selected an installer, and I'm just going to ask Jen a question. Have we received an application from them yet that do you know of? No.
Not as of this afternoon.
All right, well, tomorrow I will call and find out and make sure you guys get the paperwork to prove to you guys that it's started, that we're having it started. But I apologize, but my dad was really sick and I had no idea until I got to going through all his mail.
Is anybody living in there right now?
Yeah, I'm here. I'm staying with my mom and dad now.
When did you have it pumped last?
It was pumped 4 weeks ago. I'm out here on the deck now looking. There's no leakage anywhere. They've put sand everywhere. I wish I could turn it around to show you guys. You can see what I'm talking about. But they've got 1, 2, 3, 4 holes dug, covered over with dirt. There's no leakage anywhere. Right now, anyway.
The application is the application in, Jen, so far?
No, not yet.
Where do I get it? Where do I get an application?
Robert Hour, your installer, should submit an application. They know the process. So if you tell them that your system is failing and that you're under order to upgrade, they should be able to get it to us as soon as possible.
I will call first thing tomorrow morning. Do I need to send a paper to you, or they'll send the paper to you guys?
Yes.
They will submit the application.
Okay.
Yeah.
Anything else?
So, yeah, any other questions before you hear my recommendation?
Nope.
Okay, Megan.
Okay. So I would recommend that the system upgrade be complete by August 1st. That's in a couple of weeks. It should give Robert Hour plenty of time to do the upgrade, as long as they get the application into us as soon as possible. And until then, the failing cesspool needs to be maintained so it does not overflow any longer. So August 1st is my recommendation. If the system's not in by August 1st, then I would recommend starting the fines, which is the first offense. We've done the written warning, so this would be the second offense, would be a $50 fine.
I'll have it. I'm going to call and have it done by then. I'll call first thing tomorrow morning. And I thank you for your patience.
Okay, any other questions from the board?
Nope.
Do I hear a motion to, how should we word this, Megan, that it be installed by August 1st?
Yes, you can order that the system be upgraded by August 1st, 2020, and that the cesspool be pumped as needed to prevent overflow.
Okay. Do I hear a motion?
Make a motion.
Is the inspector going to come by weekly to make sure that it's pumped? So how's that going to work in that respect?
It may not need to be pumped weekly if it's not overflowing. So we can send someone out tomorrow to make sure it's not overflowing. And
I think that would be a good idea, just to make sure before.
Yes. Agreed.
Okay. Do I hear a motion?
I make a motion that we accept this based on Megan's suggestions.
It'd be completed by August 1st?
Yes, to be completed by August 1st. Yes.
And Ron, do you second?
I second that with the idea that somebody would come by, let's say tomorrow in another week or so, just to make sure nothing is overflowing.
Okay. All in favor?
Aye.
Sharon's aye.
Sharon, aye. Ron, aye. And myself, aye. So,
Yeah.
okay. So, August 1st, we would expect completion.
Okay.
Right.
And I wish your dad, is it your father who's ill?
It's my dad, yes.
You know, I wish him that he gets better very soon.
Thank you so much.
Okay. Take care. Thank you.
Bye.
Bye.
Okay, so I see Pete McEntee's back on the line. We can move back to the hearing for Wakeby Development Corp. at 42 Marlin Road to consider variance request to upgrade a Title V system prepared by Engineering Works. Pete, you have to unmute yourself.
I have to do it by myself, huh?
There you go.
Peter McEntee from Engineering Works. Sorry, we have a Comcast truck down the street that's playing with the wires, so I was cutting in and out. Yeah, so on 42 Marlin, we're proposing the upgrade of a septic system, upgrade of a leaching system, and the soil absorption system is intended to go basically where the original one was. Every location on that property requires a variance, so this made the most sense. Basically running it from the tank, if you have the plans in front of you, up to where it was originally, but with the new design criteria, the system is bigger, and therefore we try to balance out our variance requests to the property lines and then get a reasonable one from a crawl space. So we're asking for 4 variances under local upgrade approval. We're looking for a 4-foot variance from the soil absorption system to the side property line for a 6-foot setback, a 4-foot variance soil absorption system from the front property line for a 6-foot setback, and then a 12-foot variance between the SAS and the crawl space for an 8-foot setback. And the system is currently more than 3 feet below grade. We're going to be we want to get a variance for it to be as deep as 6 feet below grade. I don't know that we're going to be that deep actually, but let me see here. 98.6. We'll be about 5 feet at the deepest over the soil absorption system. So system will be H20 invented. I don't see any other really reasonable alternative. Repiping the basement to have the system come out the front is very, very difficult. So this is the simplest solution.
Okay, thank you. I had was muted to say I opened the hearing. Now I close the hearing. So, and any questions from the board? Okay, Megan, your recommendation?
No alterations are proposed for the dwelling, and the plan proposes to utilize an existing tank and replace the failed leaching system. I recommend approval with the conditions that the dwelling be restricted to a maximum of 3 bedrooms and that no increase in square footage or habitable space without further review by the Board of Health, and that the variances and conditions be recorded at the Barnstable County Registry of Deeds.
Do I hear a motion to that effect?
I'll make a motion to accept.
I said,
Okay, a motion to accept Megan's recommendations. And all in favor?
aye.
Sharon's in favor, and Ron's in favor, and myself's in favor, so the motion's passed.
Okay, thank you very much.
So you're all set. Thank you.
Take it.
Yep, bye-bye.
Have a good night. Okay.
Okay, the last item on your new business section is to review and potentially adopt a mandatory mask zone order. This was a result of our meeting last week, and let's see. I think I'm on the old agenda. The new agenda. So your mandatory mask zone is, I did change it from the harbor to Bank Street. Let's see. Jen, sorry to bother you, but did the meeting packet get revised as well, or just the agenda with the mandatory mask stuff in it?
I have one with them in.
You did, okay.
Yeah, I
All
believe it was revised.
I had,
Okay,
We're gonna have a time zone on this, like from Memorial Day to Labor Day, or how's that gonna work?
that's up for discussion. You could put a time frame on it. You could say until further notice. You could say,
I kind of like the further notice, only because even though Labor Day, most of the kids are back in school or whatever, I think we still have quite a few vacationers that might want to come up here without kids. And it just seems like Harwich Port is still fairly busy at that time. And I think we're going to be approaching a time where we would really need to be using masks.
I
Yeah.
agree with that, yeah.
Yeah, I think until further notice sounds good. So we're going between Sagatucket and the post office, basically.
well, I wanted you to discuss the area again. You can go wherever you'd like to go, but I think the most walkable part is where you want to focus on, and that
So
is
that would be from Bank Street to the
to Lower
post
County
office, I would say.
Yeah, to the intersection of Lower
I have
County
a
Road.
question, Mike, I'm not really familiar with the street. So Bank Street is coming out onto 28 with Embers on the left, is that correct?
Yes,
No.
Right?
That's not Bank Street.
it is.
Bank Street is further down,
Bank Street and Lower, and
further down.
Ember is on the corner of Bank Street and Route 28.
That's right, from Embers, yes, that's right.
Yes.
What did I say? What did I say?
No, you said it correctly. You did.
Oh,
I'm sorry, I was wrong. But Embers is on Bank Street, that's right, yeah.
you're still off. Okay, what my question is, if it starts at Bank Street, does that theoretically eliminate it there at Embers? What I'm saying is, should it be, I don't know how you'd word that then. In other words, I think it should include Embers.
So
Well, then
Embers
you have
is
to go further
automatically,
They
Embers
have to
is
go further down to,
automatically included in the governor's order for restaurants that masks are
Okay, sure.
required upon entering.
Okay, all right.
Oh, okay.
Yeah, okay, gotcha. Yes, I agree. Okay. All right.
Okay.
So I'd like to read
Don't further notice.
of emergency order for everyone to hear and see if there's any changes you want to make to it. Whereas the Board of Health is concerned that as summer approaches and visitors return to Harwich, the combination of large crowds and narrow roads and sidewalks will make it difficult to maintain social distancing as required by Governor Baker's face covering order dated May 1st, 2020. Now, therefore, the Board of Health adopts the following emergency order. Any member of the public utilizing Route 28 between Lower County Road and Bank Street between 9 a.m. and 10 p.m. must wear a face covering at all times over their nose and mouth and must exercise social distancing whenever possible in accordance with Governor Baker's order dated May 1st, 2020, effective May 6th. Order requiring face coverings in public places where social distancing is not possible. Face coverings required by this order may be removed for the consumption of food and drink only when the consumer is practicing social distancing from persons not of their immediate family unit. Violations of this order may result in the following enforcement actions / fines. 1, in the case of a first violation, a written warning shall be issued. 2, in the case of a second subsequent violation, a fine of $100 shall be assessed. 3rd case of a violation is a fine of $300 each day. A portion thereof of non-compliance with any provision of this order shall be deemed a separate violation thereunder. Non-criminal disposition. Violations of any provision of this order may be enforced by non-criminal disposition as provided by Mass General Law, Chapter 40, Section 21D, or by any other lawful means. Enforcement of this regulation shall be implemented by the Harwich Board of Health or its designated agents, including Town of Harwich police officers. This emergency order shall be effective beginning Thursday, July 23rd, 2020 at 12:01 a.m. and remain in effect until notice is given pursuant to the Board of Health's judgment that the order is no longer necessary. Any questions, additions, subtractions, or?
Very good. Very good.
I think it's great.
Yep.
Okay. So we have ordered and received some large sort of sandwich board signs that we are putting face coverings required between Bank and Lower County, so we can put them on the sidewalks or in front of people's businesses if they allow us, so we can start that education piece. And Cindy Williams from the Chamber has offered to help this cause by doing a radio spot and a Facebook Live broadcast. So we should be able to start getting the word out that masks are mandatory on this part of Route 28.
Very good.
Right. Do I hear a motion to accept?
I make a motion to accept the declaration of public health emergency order.
I second it.
I'm in agreement. Ron and Sharon? Okay.
Yes.
Yes.
All right. Well, I think that was written very nice. Like that.
Yes. Very nice.
Well, I stole it from Chatham, so it should be fine.
Okay.
Good. All right.
All right. The only other thing I wanted to bring up, which I didn't do in my report, was that I am planning on requesting the vacant part-time position be converted to a full-time position, which will require town meeting approval. But I think we need it, even without COVID. Having a full-time inspector rather than a part-time inspector is more, it helps us quite a bit. So I did put that in your packet that we'll be looking to increase that position from part-time to full-time.
Did you already submit this, Joe?
This was submitted to Joe and the Board of Selectmen, which they said they can't do anything right now until it goes on the operating budget warrant. So some of them felt very supportive of it, but wanted to see more documentation on it.
So the warrant, we aren't even, we're not going to do the warrant to what, September?
The town meeting will be in September. The warrant has to be printed, I think, a month earlier. So that, or maybe less than that, but we've got to get it on in the next 4 weeks.
But then it still has to be voted on before they can do it. So you're going to, wow. So they,
I'm able to fill it as a part-time position with the hope that it will get turned into a full-time position.
All
So
right.
I'm not going to be left in the lurch for the next couple of months, but I'm hoping.
Can we vote on that? Can we vote for that right now?
It doesn't take your vote. I mean, I wish it
We don't have that much clout.
It takes the vote of the town at a annual town meeting or special town meeting.
I think it's coming up at a good time.
Can we recommend that? Is that the idea?
That would be great. I can put that on for the next meeting.
Okay.
Yeah.
So in August, I'll have a solid proposal and you guys can
Sure.
vote to support it. That would be really great.
Under the circumstance, I think it's a great idea.
Definitely.
I think it's a good timing for this to come up like this.
Yeah. We have a lot to do.
Yeah. And more each day.
Yeah.
Anything else?
Nope, I think
Okay. Do I hear a motion to adjourn?
I make a motion.
I'll make a motion. Go ahead, Sharon. I'll second it.
Go ahead. We're just taking turns going back and forth.
Right.
So Sharon, first, and Ron,
Second.
I make a
and I
recommendation.
agree, and all in favor?
Aye.
Yeah.
Aye.
Okay. All right. That's it.
Right.
Right.
Thank you very much.